Greetings. It's good to be back and share a new case with you. This is a case of a 32-year-old female. She presented with optic disc maculopathy. So the plan was to restore the anatomy as close as we possibly can. The first step in these cases is inducing a PVD. That is sometimes difficult in a young patient, and some surgeons believe that this is the only step you need to take when handling these patients. However, I think there's more to be done, and there's a further step that we can take so we can improve the prognosis for these patients. So upon completing the PVD, I create a small peritomy and then use a 30-degree blade to fashion partial thickness scleral flap. Then I finish the dissection using a mini crescent blade. And using a Vanna scissors, then I cut it. And I hold it with a serrated forceps and then transfer it to the other hand with the longer axis facing the trocar. You have to remove the valve from the valve trocar. And it can easily pass through the trocar, you don't have to remove it. Then I just place it on the optic disc, and it's easier to switch hands and then to tuck it in using your left hand. The angle is more suited for this maneuver. You don't have to push very hard, but you always have to there's a slight friction. You always have to look at the vessels so you don't create an occlusion. Once you got it started, and then it goes really easy. I do this with my closed ILM peeling forceps. You can definitely do it using a blunt spatula or any other instrument, as long as you're not pushing on the discs. Once you got it going, I decide to stop, and then because there will be a lot of pressure variation as I will indent the eye, I will fix it in the final position just before fluid air exchange. I'm checking for breaks like I do in every routine case. Actually, for this patient, we will find a break that's nasal that we will laser treat. There's no ILM peeling needed, and I will do a partial fluid air exchange. This patient is phakic. This is the end of the procedure. And we also got a good results at 3 months with vision improvement. Thank you so much.